This is Dentistry Disrupted with Dr. Craig D. Clayton. I'm a wellness and biomimetic dentist, passionate change maker, social media thought leader, and educator on disrupting the way we approach oral healthcare. Come along with me as we journey towards a healthier and more empowered you. All right, Dr. Avi, it's so great to have you here. Thanks for taking the time out of your day to be here on Dentistry Disrupted. I really admire Dr. Avi. He was the first person really to reach out to us as we started this journey in social media education. He reached out to us and said, hey, I want to help you in whatever way I can. And he's been very instrumental in the path that we've taken. So I feel very indebted to Dr. Avi for this reason. And so I'm thrilled to have him here on the podcast. He is a disruptor, and that's why I wanted him here to speak with you. So Dr. Avi, I'll let you give our audience a little introduction of yourself and background and where you are today.
Yeah, look, thanks for having me. You know, there's zero debt. I think you guys, all I saw was you guys were putting out authentic content, trying to make a difference, trying to help people. And there were a lot of similarities, which we can kind of get into later, but I just saw you guys were genuinely putting your best foot forward and wanting to make a difference. And I just wanted to help because I know when you're starting off with anything new, there's always challenges. And if there was just, ways to kind of not necessarily shortcut it, but kind of move past them quicker, I was always willing to help, and I always am. But yeah, thanks for having me. A little bit about me. I guess, where can we start? Yeah, born in California, grew up in Florida, went to dental school in New York at NYU, practiced for a couple years in the Northeast, and then came down to Austin with my wife and dog back in 2020 during the pandemic. And, as a dentist starting out, I did have a lot of job turnover. And when I came down to Austin, was able to kind of level up as a clinician because I wanted to do more than just drill and fill cavities. I wanted to help my patients. I wanted to be a part of some type of transformation. I felt like there was always there was something more. And I think this is where, we're very aligned in that. And for me, instead of, I wanted to, like I said, do something more in the sense where it wasn't just, I didn't want to feel like I was like a machine. I didn't want to, I wanted to actually help my patients, and I just felt like I wasn't. So that's when I learned how to do clear aligners. So most people probably know it as Invisalign. And that procedure blew my mind because I'd never done a procedure where you were able to treat an issue and also prevent future issues all at the same time without drilling on the teeth. Like, it was completely mind blowing to me. And once I saw that, we were able to straighten patients' teeth and get their teeth into healthier positions. Patients were flossing more. Patients were more in tune with their oral health. Patients who went through this treatment came to me and started talking to me about things that they wanted to do to improve their oral health. So that was a game changer because I went from being in a burnt out place where I didn't feel like I was making a difference to being part of, hundreds of patients' transformations. And once that happened, I was then wondering, why weren't more dentists doing this? Why wasn't this procedure more common amongst our colleagues? And so then that's when I started to educate and teach fellow dentists. And I kind of was doing like a kind of consulting type job that I had created for myself. And then to essentially market those services, I was posting on social media. And so I was just sharing education mainly to dentists, just teaching them about this procedure, the benefits, how to talk to patients about it, what to do, what to avoid. And then that led to me then creating an actual online program because there was a lot of interest. And I couldn't do this one-on-one consulting service at scale at that point. There was just a lot of interest. Similar to kind of, your situation to some degree, but just seeing this kind of concept of taking something that is helping people, putting it on social media, sharing it, and then being able to support and help them on the back end was awesome. And then that grew and posted more on social media, and the online program started to grow even more and got to the point where now I focus on content creation and growing my program full time. And in September was able to actually retire clinically from dentistry to focus more efforts towards doing this kind of stuff online. So I don't really know what the category of job is. I just say do this stuff online.
That's amazing. That's amazing. You have created a very powerful tool for a lot of other dentists to find more time to slow down and focus on patient care and prevention. And so can you go a little deeper into the basically why ortho is not just there to create a pretty smile? Because I feel like in a lot of ways that's what orthodontics has evolved into. And I have patients that, have straight, pretty teeth, but then have bite issues or, jaw pain or, airway issues down the road. So can you speak to that a little bit as well, and how that's disrupting maybe a generally cosmetic procedure?
Absolutely. Yeah. So that's been a huge thing. So I think to kind of talk on that subject, you have to rewind a little bit and really just talk about how Invisalign started, right? So Invisalign, the most popular brand of plastic that moves teeth, they have poured in hundreds of millions of dollars into marketing, right? And they've done that for the last 15 to 20 years. So their whole thing was they were trying to educate the population, the general population, on, essentially like why having a straight smile is important. And they hit it from every angle. They did talk about some oral health, but they also focused a lot on the cosmetics. And I think, that resonated with some people, but for a vast majority of the population, not that many people were actually wanting the smile, the aesthetics, right? I think where it hit home was when they started to piece in the oral health messaging, which is what they've done as of late. And a lot of dentists were consuming the same marketing that patients were, of clear aligners, Invisalign. They straighten your teeth. It's a pretty smile. That's what everybody wants. But, that wasn't the case. And so, digging into the oral health aspect, the reason why it's so important is because when your teeth are not in a healthy position, whether they are crowded, they're spacing, they're taking excess force, that leads to problems. And I love using the analogy of just comparing it to a car. Like you've got your four tires, right? You've got your four tires, and if all your tires are balanced, and you drive, it doesn't matter if it's rocky surface, flat road, you're going to get this even kind of wear that happens throughout the tires, and they're going to last much longer. Now, let's say some of those tires are not balanced, which means your front left tire may be taking on more of the road than the front right, and same thing in the back. Those tires are going to wear down at an uneven pace, which then can affect other parts of the car, right? And so when you take that and compare it to your mouth, it's the same thing. If certain teeth, like your back teeth, or rather if your front teeth are taking a lot of the force, that is going to have an uneven kind of wear long term on your teeth, which can cause teeth to break, can cause sensitivity, can cause gum problems, and all that stuff, which then leads to more procedures being done, where when you tie in that preventative aspect of having straight teeth, you actually can balance everything out regardless of your age, so that way down the line, your teeth are actually being used the way they are supposed to.
Okay. That's a great analogy. I like that. Something that's, good to understand, that wear and tear on a car, on tires, on other aspects of the vehicle. Mm-hmm. And
I also stopped after that because I don't really know that much about cars, so I wasn't going to get into transmission and all that stuff. I just kind of kept it right there.
No, I think that's very appropriate. Very appropriate. I love that. And something that I've really enjoyed learning more about you and this is something we connect on a very deep level about, is the disruption that needs to occur in the dental industry at large. And so I know you spoke a little bit about your experience in a more corporate situation as far as the grind, the work, the patient load, all of that. What else have you seen? I mean, one of your most viral reels, if I'm correct, is talking about that toxic environment that's being passed down through generations of not sharing, essentially the secret sauce, sharing the education of this is how you do this and this is how you adapt, and here's how this evolution will occur throughout your career, and instead of it's we're thrown into this environment that is very, very difficult to adapt to and that we're not adequately prepared for. So what was your journey like? How give us some more details on how that started, and then how it evolved to where you are, and then what you would like to see and your active part in disrupting this problem in the future, which obviously impacts patients in a very complete way, of course, because they are the people that are the beneficiaries of that change in philosophy.
Yeah. So I think the first part of that is, right, the toxicity in dentistry and kind of why certain things are being gatekept. And, my perspective, which I think resonates with a lot of people, a lot of other dentists that have gone through it, is it's almost as if dentists traditionally, like when they find success or they find things that work, they're not like so willing to share it with colleagues, right? Which I think is very different from a lot of other industries that I've seen. And they almost kind of just, it's like, yeah, like you said, they find the secret sauce, they figure it out, they do it, they have their success, and then they just like won't share it with anybody else. And especially the next generation. So it's like, that's why you get an industry like that happens time and time again. Then what ends up happening is the industry doesn't move forward because each next generation is starting from ground zero, right? They're starting from the problems. Like every industry has problems. Every industry has things that they have to overcome. And I think in dentistry, more often than not, you're getting people who are not willing to share that or not willing to mentor. And, there's a bunch of variables that can go into it. But at the end of the day, like every dentist can tell you when they graduate dental school, they don't feel necessarily fully equipped to do everything. And I just think that's just the nature of how schooling in dentistry works, which is its own topic. But you come out knowing, like for everyone that's not a dentist, right? It's like, just imagine you come out, you kind of know enough to like put one foot forward, right? You don't know enough to like jog or run or sprint. You just know how to like kind of just put the first foot forward, and you're trying to learn how to walk, right? You're trying to learn how to walk. You're trying to learn the basics, because surprisingly, dental school actually doesn't teach you much of that, or they do, but it's not as effective. So it's very much like cool. And every older dentist will say, find a mentor, find someone you can learn from. And so that's what you do. That's what I did. I came out and I was looking for a mentor, and people will promise mentorship when you take certain jobs, but they don't always deliver on that because they're busy. They have schedules, they have patients, they have things, they are running a business as well. So it's very rare to find a genuine mentor who in dentistry that I found that is like actually trying to help you succeed. Because here's the other thing. Even if you find let's say a dental associate, brand new grad comes out, they find an owner who's willing to teach them and they teach them. What ends up happening that I've seen is that owner who's willing to mentor them, it's like almost like as of a certain point where that associate starts to grow and they start to actually become a better dentist, and maybe they start, having more success than the owner from just like the number of procedures they're doing or whatever the variable is that they're measuring. Then some owners, their egos, I think, kind of don't like that. They don't like that they're not the main star of the play or whatever you want to call it. And then they'll start to sabotage them. They will start to take patients from them. They will start to take bigger procedures from them, which doesn't make sense at all. Because from a strictly business perspective, like obviously there's the one aspect of like continuity of care for patients. Like patients should be seeing the same provider, or at least if there's a change in provider, there should just be some alignment there. But what I've seen is like, then you transition over to the business side of dentistry, where it's like if you're an owner, you make a percentage off of your associate, right? So it's like from a strictly business perspective, like you should want that associate to be doing as much as they can to help your patients in the practice, because the busier they are, the better it is for the practice from, even from, especially from a financial perspective.
Oh, absolutely. Yeah.
So now tying this into my job history, like I've been in practices where I've had a bunch of situations. One practice mentorship was promised, but when the time came where I started working there, the owner wasn't actually around to mentor. He wanted me to basically just work essentially and cover for him, which is fine. I think that is a totally acceptable thing. But when mentorship is promised and it's not given, it's actually, it's a challenge, right? I've had offices where they say they're very busy, right? And a lot of dentists, I don't know if people know this, but dentists for the most part are being paid essentially on commission, right? Like whatever procedures they do, they are walking home with a percentage of that. They're not walking away with the full fee, right? So if a procedure is $1,000, the dentist does not get all 1,000 of those dollars. Like it's actually just a percentage of that. And so there's, right, the dentist also has bills to pay. Like there's student debt, there's other bills. So, from that, when you're young and you're starting out, you're not necessarily just chasing the money. You are actually trying to learn. You are trying to help patients. You are trying to do things that, are fulfilling, because that's what draws us all into the procedure. And you trust that the finances will take care of themselves and the money will come, because, at the end of the day, you want to help as many people. And when you do that, it just the way the universe works, that tends to come back around, right? In different ways.
Yes.
Right. So you're not really stressed about the money, but then what happens is then when you go work at a practice and they say they're very busy and they say there's a lot of patients for you to see, but then you actually get there and they're really not that busy and you're kind of sitting around, your bills are still rolling. You still have to make payments there. And so it puts dentists in a sticky situation. And so I've been in those situations, and it's like I always kind of stayed to my moral compass and ethics, and I never overdiagnosed or overtreated just for the sake of the money. But that can then lead you to being in a practice where you're not busy, and then the owners will let you go, right? So, and the reason why I'm bringing this stuff up, right, is just because to show you that like when you start off, there are challenges that you're trying to navigate, and you're trying to navigate all this while still learning how to clinically be better, right? Because like clinically, when I came out, it was you're just not that well versed. So, this is where, and then just to kind of wrap that up in terms of just the generational stuff, it's like you only know what you're exposed to, right? So like if you work for these dentists who are doing outdated methods and they're not actually staying up to date with procedures or information. For example, I know you practice, the way you practice is very much, wellness forward. You're looking at more than just the tooth. And that is something that I feel like patients think all dentists think like that, but the reality is that's probably less than, I don't know, 10%. Yeah. And so it's like, but for me as a young dentist, like I didn't know who I could learn to do that kind of stuff from, because to me, the only person I could really learn from was the doctor that I worked for. There weren't that many accessible programs out there or just accessible information, which is why nowadays with social media and people like yourself, like I learn a lot from you. Like there's stuff that you talk about where I'm just like, oh, wow. Like I guess that's how you can prevent cavities. Like it's crazy. Like everybody
It's crazy,
thinks,
right? Like,
everybody thinks that dentists know that, but it's like to a certain degree we
Yeah.
do. But the level
Yeah.
of detail that you do and the fact that you just share it and it's consumable, like, yeah, I'm gonna listen to you and share that, you know what I mean, with other people, because they don't like go into that level of detail in dental school. Like that's just the facts.
Yeah, and you just explained so wonderfully why let's say, let me back up a little bit. The question that I am asked probably most frequently, besides what product should I use, is why can't I find a dentist that practices this way? Or why do more dentists not practice this way? And then that gets translated into the assumption that dentists are greedy and money hungry and not trustworthy. And so I also try really hard to preach and clarify, no. Most dentists, the vast majority, have very good intentions and want what is best for their patients. But as you just so wonderfully explained, we get into this cycle where that information isn't passed on, the prevention isn't incentivized. And I use the example of, in dental school, I had one class on the study of cavities. And even then, the takeaway was eat less sugar, better oral hygiene, use high-strength fluoride if you're an at-risk patient. And that's like the takeaway. And it's a 3-credit-hour course and, 200, 300-plus credit hours over 4 years. Yet we spend 4 years learning how to prepare teeth for crowns and do fillings and all the
It's crazy because
reactionary
that
dentistry.
that same class, I remember taking it, and afterwards I was like, I already knew that. Like I was just kind of like, I thought I was going to learn something that I didn't know, because like I wasn't a dentist before, but it's like, okay, like that's it, like that's all we got.
Yeah, it's wild. And so, it's such a beautiful explanation of, it's not the dentist's fault. It's this generational cycle that holds us back, and and the, like you said, the lack of mentorship, but really just the general lack of knowledge.
That's
and
it.
then
Well, and also lack of just sharing the knowledge too, right?
Yes,
like I'm not gonna
that competitive mindset.
I don't want to excuse all dentists. Like dentists
Sure.
are definitely, they're at fault to a certain degree, right? Some of it's lack of education. The other is just like the willingness to share, and also like when new ideas are brought forward that challenge conventional thinking, they're like almost shut down and like just completely dragged throughout, right? Like I've had
they're
dentists
not even
like,
considered.
no, like an onlay or an inlay. Like I worked with a dentist who had 20 years of experience. He's like, oh, well, they're going to break anyway. Like he's like, it's just going to be a crown. You might as well put the crown on now. And like as a younger dentist who had no exposure to like other sources of information, you kind of just take it as truth, because it's like, like I remember doing it in dental school. Like we did practice onlays and inlays, but the number of onlays and inlays that I practiced in dental school versus the number of crowns that I practiced, night and day. Put it this way, I was spending time outside of our dedicated lab time practicing crowns. I don't think I ever did that for an inlay or an onlay, because it was like one time they showed you how to do it. You kind of did it. You got graded on it, but it was like kind of wishy-washy, and like that's it. But the crown, oh my gosh, like
Yeah, I mean, even
sleep over that.
We're not tested on inlays and onlays for our hands-on exams. And I remember spending so little time on inlays and onlays, like you just said, as well as even being told by attending clinicians and teachers that crowns are paid for by insurance, onlays and inlays are paid for by insurance, therefore patients are going to want the crowns anyways, and you should do crowns because let me turn my camera back on. I'll finish this thought. But you're going to do crowns anyways because and patients won't want to pay for it. So it's like we were taught to not give patients the more conservative treatment option, and we were taught that insurance then dictates treatment. And it's just that started in dental school. I mean, it's like if you
and that's
think
when you're
about
the most vulnerable. That's when you're the most vulnerable.
was like dental insurance is essentially influencing the curriculum we're taught in dental school. Like, how messed up is that?
Then it basically, right, it's like it's setting you up to fail, because then when you come out, you have to like challenge the norm, which is not normal for most people, right?
No.
And like dentists
No.
also as personality types, like a lot of dentists are like, people become like, I mean, me and you, we're alike, and we're also very different from our colleagues, but like
Yeah.
most dentists are not out here trying to change the game. That's not why they chose to be dentists. Like,
No.
a lot of them chose the dentistry for stability, help some people, make some good money, and just like live their life. Like that's pretty much like I've had thousands of people on webinars, thousands of dentists on webinars, and I've asked the question, "What brought you in?" And everyone's saying the same thing, which isn't that hard to believe. But like,
Yeah.
now you've got them pretty much behind the eight ball with this limited mindset, limited thinking pattern of how to actually practice, right, dentistry, which is catered to the insurance, everything. Like and that's the thing, is like they'll tell you all the good stuff, and then they're like, but do it this way, right? They're like, yeah, like you should be conservative. Like they make you terrified to cut teeth, but then when they do that, it's like, then they're like, oh yeah, but do these procedures because insurance will pay for it. And it blew my mind also, because when I first started working at some of the practices, I was just like, we should be prioritizing what the patients need. Like I just kind of knew that in my core, because I did have some professors that kind of told me that, and they're like, don't give into insurance in that way. Like do what's best for the patient, do what's best for the patient. But then some of the practices I worked at, like they ran the clinic catered to the insurance. Like they wouldn't do the treatment until they got like pre-authorization from the insurance. And they just completely like structured their business around that. And they structured their business around maximizing the insurance. So then it's just like, if that's again, it comes back to like, this is where young dentists are learning from. So you just learn these practices, these older practices, and then like you go on and you have to really, really challenge the norm, because that's how the norm is these days. And then you do that, and it's tough, because if you don't take insurance and you actually, do dentistry the right way, right? You do dentistry where you're actually prioritizing the patient's health, you're probably not going to make a lot of money in the beginning. Yeah. And like that can terrify people. And so I think what a lot of dentists do is they end up taking the insurance when they start their practices, because they want patient flow. They tell themselves that they will treat the patient with the best interest. But then I genuinely think what happens is when patients walk in the door and they've got these like discount, then then you get these discounted fees, which that's just the contract of insurance. Now they cater to that, and then they'll try to do all these extra things to make up the money that they should be charging. Well, when in fact, if they just didn't take the insurance and provided quality care from the beginning, yeah, you're seeing less people, but everybody wins, because you're going to attract the people who are willing to pay for your services. You are going to help the people who value it, right? And then you are going to walk away making what you feel you should and deserve. And I think that's how it should be, because you don't need to, like, that's the thing, is like dentists feel like they need volume. They feel like they need to see everyone under the sun, but that's just not the case. Like every patient is not for every dentist. And I'm not saying like insurance needs to be eradicated. There's a place for it, right? There's an audience, right? There are people, there are human beings that don't really value their oral care more than just getting a couple cleanings, right?
Yeah.
And that's it. And that's fine. And there are dentists for you. My thing, and I believe your thing too, is like, if more general dentists would just start to almost bet on themselves and I think if they just believe in themselves more and they take this risk of going against the norm, they can provide the dentistry that they actually want to do. Like you ask so many dentists out there, and a lot of them, I bet, will tell you that they're not actually practicing dentistry the way that they had imagined or the way that they truly believe they should be practicing. And so that is what adds up, because when times get tough and things get stressful and you're not even doing something that you genuinely enjoy doing, like that's why so many dentists burn out. And that's why you have dentists who, that's why the suicide rate is so high. And it's just because you're doing so many things that actually aren't aligned to you. And it's like you've gone so far past what actually got you into the field. And this is just a systemic problem that's in the field.
Oh, yeah. Oh, my gosh. 100%. It's such a problem. And this is, I mean, again, this is why the field is so hard to change. And there's a lot of scarcity mindset of because of this insurance and all these different factors, and it's scary to challenge everything that we've been taught, that it's very hard to change this field. So I look forward to working with, passionate people like yourself, and I'm sure we will continue to find more and help to drive this revolution through education and through, helping dentists see that there is a way to create a win-win situation and practice dentistry that's more conservative, comprehensive, holistic, all the while being able to essentially focus on preventative also, and it'd still be able to keep the doors open, the business afloat, even without doing all the technical procedures. So, but I wish we could just keep speaking for another 30 minutes, but I've got to wrap up and run off to an appointment, unfortunately. But I wanted to, before we close, I want you to tell our audience where they can learn more from you, especially those doctors that are listening to this.
Yeah. Easiest way is to follow me on Instagram. My handle is dr.avi. And I also have a YouTube channel. Same thing, Dr. Avi spelled out. And if you have any questions, shoot me a DM. I respond to everybody. I try to, but I will get to your message. I love having conversations like these, man. I really appreciate you having me on.
Oh, it's been great. And let me tell you, Dr. Avi's content is stellar. It looks good. His energy is always on point. It's inspiring. I can't help but to just feel motivated and ready to tackle the next problem after watching your videos. So thanks for bringing that
Thanks,
energy and that passion consistently.
That means a lot. Yeah, I definitely pour a lot of passion into them. So to hear that, they're being well received, it means a lot. And again, your guys' content is amazing. I think you guys are doing such a good job educating the masses, and it's just super cool to see you guys grow and impact so many people at different levels. It's awesome. And I knew you guys, I'm not going to say I told you so, but I told you so. Like, I knew this was going to happen. I knew you guys had absolute fire in your hands, and I could see your passion. And I just knew that if you guys stayed consistent, like, you would be able to help so many people. And it's just really cool to see where you guys are at. And in my opinion, like, I know you guys are just getting started, but it's really cool to see.
Thank you so much. And likewise, I know that you're just getting started and that you've got a long-term vision that's outside of the clear aligner education field. So I'm really excited to watch you continue to grow and morph. So thank you again, Dr. Avi, for taking the time to be here and chat. And I hope that we can have you on again in the future, and we can to have the opportunity to continue this conversation.
Absolutely. Thanks for having me again, man.